Mr. President, among the many promises the President made when he and congressional Democrats enacted their unpopular health care law nearly 4 years ago, and by the way, that was enacted without any bipartisan input or support, there was one thing in particular that Americans definitely have not forgotten. It was a promise that President Obama repeated over and over again to the American people. At rally after rally, you can't turn on the TV these days without it being played, or the radio, or pick up a newspaper without this being played over and over again, because it was so ingrained in the thoughts of the American people. This promise that the President made so definitively, shouted and pounded on the, if you like your health care plan, you'll be able to keep your health care plan. Period. By saying period behind it, it's sort of like it puts the stamp. That's it. No disagreement. If you like your health care plan, you will be able to keep it. Well, here are the facts. This program has been in place for 1 month and a couple of days. Already, at least 3.5 million Americans have received cancellation notices from their insurance companies. Lord knows how many more letters are in the mail, or will be in the mail, arriving at Americans' mailboxes in the coming weeks and months ahead. So, if you like your health care plan, already, and you can keep it, already 3.5 million Americans have been told, no, you can't keep your health care plan. And thousands of Hoosiers have already received those letters, and they'll continue to receive more. Rebecca from Muncie received a letter saying her individual health care plan will be canceled. She's also learned that the premiums in the government-approved plans are double and triple of what she's paying now. Remember, this won't cost 1 penny more. Dwight from Indianapolis wrote to me and shared a similar story. Dwight also received notice in the mail that his health care plan is being terminated. And when he started looking for an alternative government-approved plan, by the way, one of the few that was able to get through the website, he experienced sticker shock, dramatic increases in his premiums that he would have to pay for having his plan terminated, and now has to buy the Obamacare plan. And that sticker shock was felt by Garth in Marion, Indiana as well. Garth told me that his family's health insurance costs will be more than 3 times as much under Obamacare as they're paying now. I'm not sure that, well, I am sure, Rebecca, Dwight, Garth, and tens of thousands of other Hoosiers now have found the promise that they could keep their health care plan if they like it. They found that promise a broken promise. But despite the repeated promise by the President for several years to the American people that you can keep your health care plan if you like it, period, we now have learned that the White House knew all along that this wasn't true. For at least the past 3 years, the White House has known that millions of Americans would receive cancellation notices and lose their current health care coverage. Yet the President has continued to package this flawed product with false advertising and apparently deliberate dishonesty to sell it to the American people. And we wonder why Americans are losing confidence in their government. We wonder why there's such an alarming trust deficit in the country today. As the Washington Post writer Chris Cillizza wrote recently, when you're the president, words matter. Mr. President, words matter. Your words were, if you like your health care plan, you can keep it, period. Mr. President, that was a false promise. And it has undermined the confidence and trust of the American people in this president and in this government. Because the fact is, you can only keep your health care plan if the Obama administration likes that plan, and apparently there's millions already of plans that they don't like. And the ones they do like are their own creation with multiple doubles and triples of premium costs. In 2009, the President also said We will keep this promise. If you like your doctor, you'll be able to keep your doctor, period. The President keeps enunciating his promises with a period. That means that's it, final. Nothing else to say about it. And the fact is also that under Obamacare, many individuals are not going to have access to their doctors that they've trusted for years. If the White House had been honest with Americans, would the administration have promised that people could keep doctors that they like? And many individuals and families are seeing higher premiums, higher copays, and higher deductibles under Obamacare. If the White House had been honest with Americans, would it have told the public that the health care law would save families up to $2,500? Haven't seen any of those stories yet. And the President's response to all of this, and the millions of Americans who have had their insurance coverage canceled, he says, just shop around. Well, first of all, maybe the President has forgotten that Americans can't even shop around because his website doesn't work. Maybe the President hasn't tried shopping around himself because he and his political appointees are not required to join Obamacare. That's right. Everybody else is forced into Obamacare, but not the President, nor his appointees and his team. They think it's good enough for the American people. So they're not going to be forced to join it as the rest of us are, including members of Congress, which is okay. We should join it. We should be forced to join it. Because if we're going to impose this on the American people, it needs to be imposed on ourselves so that we feel the pain just as they're feeling the pain. But the President, exempted. President's appointees, exempted. What kind of leadership is that? Individuals and families that have been able to shop around are finding that many of the Obama-approved health care policies are going to cost them more money, not less. Middle-class families are getting hit with massive premium increases and outrageous deductibles. Remember, the point of health care reform was to lower the cost of health care and increase access. But we're seeing just the opposite of what the President promised. I think it is now clear that if the White House had been honest with the American people, this law would never have been passed in the first place. It was Abraham Lincoln who once said, if you once forfeit the confidence of your fellow citizens, you can never regain their respect and esteem. It's true that you may fool all of the people some of the time. You can even fool some of the people all of the time, but you can't fool all of the people all of the time. And unfortunately today, many Americans feel like they've been fooled by a series of promises from this administration and its supporters that were simply not true. And given the many problems and broken promises with Obamacare, given the law's negative impact on American families, the sensible course of action at this time is to take a time out from implementation of this law. Recent polling shows that nearly 3 in 4 Americans voters now support delaying Obamacare's individual mandate. In September, I introduced a bill to delay that mandate for a year. The House has already passed similar legislation offered by my Indiana colleague Todd Young to delay both the employer and the individual mandate. And by the way, 22 House Democrats supported that language. So the first step we should take today is to pass this legislation to delay the Obamacare mandates and put people over politics. There's a lot of work ahead to deliver real health care reform. We need to bring down the cost of health care, not raise it. We need to put patients in control of their health care decisions, not Washington bureaucrats. And we need to increase competition, reform medical malpractice, and allow people to buy insurance across state lines, create risk pools, and a number of other initiatives that have been put forward here that would make it an affordable health care reform and not the unaffordable, overpromised, underdelivered health care plan that American people are now having to deal with. Delaying the individual mandate will give the American people an opportunity to voice their displeasure over this false information by the President and the chance to start over with a real, honest approach to health care reform. It's time to start now. Mr. President, with that, I yield the floor.